I've been smoking since I was 15. And right now, I'm 61 years old. I've been singing in the choir at Dulois Community Baptist Church for 18 years. And my pastor's wife, Miss Mary Parker, stayed on my case about stop smoking. It wasn't good. And I just used to say, oh, all right. I just brushed it off. But I wish I'd have listened a little bit sooner.
Just take a few minutes to
Because really my health might be a little bit better than what it is now.
Oh, hey, Miss Lillian, how you doing? Good to see you today. Good to see you. How are things?
Dr. Stagg been on my case in 1992 about smoking. And every time I come for my appointment, Miss Lillian, are you still smoking? Yes. What have I told you?
I work every single day with every single patient trying to get them off of cigarettes. Cigarettes are the bane of my existence. The reason that smoking is so personal to me is that I'm 57 years old now. Well, my mom died when she was 53, and she smoked all her life, and she died of lung cancer. It almost brings me to tears thinking about all the stuff she missed, and all the life she missed, and how much we miss her, and all because of cigarette smoking.
Are you breathing better?
Yes.
I figured you would.
Smoking causes 80% to 90% of lung cancer, 80 to 90% of chronic lung disease like emphysema and chronic bronchitis. About 50% of cardiovascular disease is directly related to cigarette smoking. So, is it hard to tell people to quit smoking? No. It's very easy to tell people, you got to quit smoking. But it's so hard to quit smoking.
My mother stayed on my time about smoking. I quit for 2 years, and I started back. But after she passed, I started smoking again, and I've been smoking ever since. Until that Sunday I came from church. I never watched By Your Time. I said I was going to look at By Your Time that day. Who did I see?
Welcome back to By Your Time, and let me introduce the panel. Well, you know Dr. Jody Stagg.
And it was talking about smoking.
Stop to think about it.
And some of the things that he was saying smoking do to you.
Most people that smoke end up with a cigarette-related illness, and that's either cancer, or it can be osteoporosis, it can be heart disease.
A lot of people are going to watch it, are going to say, all right, no more excuses. Dr. Stagg fussed at me on TV, no more excuses.
I say, oh, he talking about me. So I remembered the number and I called it the next day. I was having pains in my leg, shortness of breath, finger swelling, ankles, skin itching.
Because through the years, you've been having symptoms of, you have a little blockage in the heart, your heart's a little on the thick side. You also have symptoms where your heart beats too fast and palpitations.
The smoking cessation program that we've started has been very attractive to our patients. Many patients say, I cannot do it by themselves, or I cannot afford the medications. Now, our doctors can have a different approach with this patient.
Any Louisiana citizen who began smoking cigarettes prior to September 1st, 1988, can enroll in the trust. The trust provides medical services that are designed to help people stop smoking. That includes a basic office visit with your doctor. You have access to counseling programs, which are highly effective in combination with medication, and we cover all the cost of medications that are recommended for quitting smoking. The program pays 100% of all approved services. There's no out-of-pocket expense. Anyone who's eligible can quit smoking for free.
But I'm glad I called. Because since I've been on the patch and the pills, I've been doing fine. I haven't been wanting a cigarette. Especially like in the morning when I wake up, I usually smoke 2. And after everything I eat, I smoke. Right now, I don't do it, and I feel 100% better. And I haven't smoked since I got my patches and my pills.
How about when you're out walking and stuff now? Do you feel like that you're getting better air and that you're feeling better?
Well, I don't get out of wind anymore. Dr. Stagg act like he's more happier than what I am, like if he was the one quit smoking. But I did it. I should say, we did it.
Is it too late to stop smoking? Or is the damage done? Am I beyond repair? And the answer is absolutely, unequivocally no. It's never too late. If you quit smoking today, that it's not that long in the future that you will be at the risk of somebody who's never smoked before.
I quit a month and 15 days ago, and I feel great.
That's
I feel like I could run a marathon right now. At first, I couldn't even walk a half a block without stopping. And I'm hoping by me quit smoking, I could add 10 more years to my life. I could look at television without smoking. I could eat without smoking. I could get angry without smoking now. And that's the best part. And I'll tell anybody, quit smoking, because the life you save may be your own.